Before starting the treatment with Lemtrada Vial, it is important to read the medication guide, patient safety information card, and the patient information leaflet provided by your pharmacist. Always carry the patient safety information card with you, and if you have any questions, consult your doctor or pharmacist. Lemtrada Vial is given by injection into a vein over a period of at least 4 hours by a healthcare professional. The treatment is divided into 2 courses. The first course is usually given daily for 5 days, and the second course is usually given daily for 3 days, with a 12-month gap between the 2 courses. Additional 3-day treatment courses may be given if necessary, but they should also be separated by at least 12 months from the previous treatment. Before receiving Lemtrada Vial, your doctor will instruct you to take other medications to help prevent side effects, such as acetaminophen, diphenhydramine, and corticosteroids. Your doctor may also prescribe antiviral medications to help prevent infection in your body. It is important to use these additional medications exactly as prescribed by your doctor. To reduce the risk of serious side effects, your doctor will monitor you for at least 2 hours after each injection. During or after the infusion of Lemtrada Vial, you may experience headache, fever, chills, flushing, mild rash/itching, nausea, vomiting, shortness of breath, tiredness, or dizziness. If any of these effects occur, make sure to tell your doctor or pharmacist right away. They may prescribe additional medications to help control these symptoms. Diarrhea, stomach/abdominal pain, cough, trouble sleeping, or mouth sores may also occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. While using this medication, you may experience serious side effects. However, your doctor has prescribed this drug because the benefit to you is greater than the risk of side effects. It's important to tell your doctor right away if you experience any serious side effects, including mental/mood changes, muscle/bone/back pain, joint pain/stiffness, signs of thyroid disease, and signs of liver disease. This medication may also increase your risk of getting a rare but very serious brain infection called progressive multifocal leukoencephalopathy, PML. Seek medical help right away if you experience symptoms such as clumsiness, loss of coordination/balance, weakness, sudden change in your thinking, difficulty talking/walking, seizure, or vision changes. Additionally, seek medical help right away if you experience very serious side effects, such as fainting or chest/jaw/left arm pain. If you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing, get medical help right away. This is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before starting treatment with Lemtrada Vial, it's important to tell your doctor about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. You should also discuss your medical history, including any immune system problems, recent infections, or other health issues. This medication may cause dizziness, so it's important to avoid alcohol or marijuana while using it. You should also be cautious when driving or operating machinery. Before undergoing surgery or receiving a blood transfusion, make sure to inform your doctor about all the medications and products you are using. Lemtrada Vial can also affect your risk of infection, so it's important to discuss your vaccine history with your doctor. You may need to receive certain vaccines before starting treatment. During treatment with Lemtrada Vial, it's important to take precautions to prevent the spread of infections, including washing your hands regularly. This medication also increases the risk of a serious infection caused by a bacteria called Listeria. You should avoid certain foods, such as deli meat and unpasteurized products, or ensure they are heated properly. To reduce the risk of injury, use caution with sharp objects and avoid contact sports. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as Lemtrada Vial may harm an unborn baby. Reliable forms of birth control should be used while using this medication and for 4 months after the last dose. Breastfeeding is not recommended while using Lemtrada Vial and for at least 4 months after stopping treatment, due to the potential risk to the infant. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Lemtrada Vial. It could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Always consult with your healthcare provider for the best time to take this medication, the daily dosage that is right for you, and the potential benefits it can provide. If someone has taken too much Lemtrada and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can contact a provincial poison control center for assistance. Before starting treatment with Lemtrada Vial, it is important to undergo various lab and medical tests such as complete blood count, EKG, kidney/liver/thyroid function, skin exams, tuberculosis testing, and urine tests. These tests should also be continued while you are receiving the medication and for some time after the treatment is completed. It is essential to keep all medical and lab appointments and consult your doctor for more details on the specific testing schedule. Make sure to take each dose of Lemtrada Vial as instructed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best plan for your new dosing schedule. This medication is administered in a medical facility and should not be kept at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.